So I'm going to be getting most of my information from a book that I read entitled The End of Poverty by the world-famous economist Jeffrey Sachs. Now, this book was written in 2005, so some of the information and some of the statistics in the book, if you so choose to read it, is outdated. However, the ideas are still very much applicable to today. And I think that if everybody read this book and everybody took something different from our world would look very different and be greatly improved. I think that we can all agree that healthcare in America is absolutely amazing. There may be political aspects of it that we don't necessarily agree with, but the physical care that we get inside hospitals and inside clinics is world-renowned. There are also different emergency procedures that happen in emergency rooms, and different paramedics and ambulances that get to the needed destination quickly and perform what they need to efficiently. There are cancer treatments, procedures, and vaccines that save lives every single day. We have had so many different resources to build up the American healthcare system to how it is. There are other developed countries around the world that also have really good healthcare systems that work for their country and are different than the United States. However, many developing countries do not have a basic healthcare system, and this can be seen when looking at how their economy looks. One major claim that Jeffrey Sachs makes in his book, The End of Poverty, is that basic healthcare is an enabler of solving economic problems. So if you think about it as a ladder, basic healthcare gets these developing countries onto the first rung of the ladder, then themselves being able to step up the ladder, get to on a world platform and a world standing. Now, we're going to compare the United States system with different nations in Africa. There are other developing countries, I understand, who do not have as good of healthcare systems. However, when comparing it to different African nations, we'll get a more wider view of it. Hospitals are generally understaffed compared to the United States. To give an idea of that, hospitals in various nations in Africa have about one healthcare professional per 80 patients, compared with the United States that has one healthcare professional to every 15 to 20 patients. So there are not enough doctors going around to help patients that need to be treated, and that proves a detrimental effect. Another thing is that many villages and cities in Africa do not have healthcare treatment centers and therefore are not able to help all the patients that need to be helped, resulting in preventable deaths. Now, the United States is very well developed, as I said. However, there are beds for everyone in the hospitals. There are enough IVs and resources and antibiotics to treat everyone. Now, that does not mean that everything is 100% perfect all the time. However, there are tuberculosis patients, AIDS patients, and malaria patients sharing the same beds, or not even having beds at all. They have to be treated on the floor, waiting or just waiting for treatment. There are not enough resources to go around to help these people who need the most help. Now, those diseases that I talked about earlier, AIDS, tuberculosis, and malaria, there are cases of those in the United States every year, and people do die from them, but not on the same scale as they do in developing countries who do not have healthcare systems set up. AIDS is not a curable disease. However, it is preventable, and symptoms can be alleviated with different antibiotics and medications. But, as I said previously, there are not enough of those to go around to treat all the people who need them. Tuberculosis is an infectious disease that attacks the lungs. There is a vaccination for that, and there are antibiotics to help treat that once one does contract it. And malaria. It hits hard in many different tropical countries, and although there's no vaccination for it, there are different options, such as many tourists who go to developing countries that have malaria choose to take pills before, during, and after the vacation so that they won't contract malaria, or they'll have a fewer risk of getting so. There are also different antibiotics to go on once one does contract it, and those are in ready supply here in America in the places where malaria is most prevalent, but it's not where it needs to be. It's not in developing countries that need it the most. So there are probably some of you thinking, well, how would this affect me? How does this tie to me? And that's a completely valid question. And the reason for that is two things. The first reason is that, as we talked about previously, there are many different resources that we have here that we might not even realize we have, even if we might not be in the financial standing that we want to be in, or we're not in the place where we want to be in. We have so many different resources that people don't even have the opportunity to have in developing countries. And another reason or answer to that question is one that Sachs presents in his book. And this being, once we help these countries get to where they need to be to have a basic healthcare system, they can eventually rise on their own and get to a place where they can offer so much to the United States on an economic standpoint. And they can be able to get to that point if we can help them. So there are a variety of different solutions to this problem and ways about going and solving this problem. One of the ways that this problem can be solved is if developed countries who have a really good healthcare system and have it figured out can partner with developing countries who are still trying to find this system so that they can rise economically. This can be through sending different resources, whether that be volunteers, healthcare professionals, vaccines, antibiotics, or just money. This can also be achieved by if our Congress set aside specifically for this cause. And a point that Sachs makes very clearly in his book is that this wouldn't have to be a ton of money. We probably wouldn't even see this in our day-to-day lives. We wouldn't see how this affects us directly because it would be such a small amount of money to us, but would make the world of a difference for these developing countries struggling to find a system. Now, something that we could do physically today, because options are totally achievable, however, it would take a lot of people fighting for that cause and fighting for the United States and countries around the world to help developing countries who do not have the same resources and have not had the same history and luck that we had here in America. So what we could do today includes donating to different causes, donating to buy malaria bed nets, which is a prevention technique that many choose to use that are insecticide treated, and sending money to research of that because new research has proven that malaria bed nets that have been used for a long time and have lasted, the mosquitoes are starting to not be affected by that anymore. They're starting to get used to the insecticides and be able to go and still spread malaria at a rate that is really high and nobody has seen before. So what we need to do is invest in family planning, invest in these companies, but mainly for a bigger solution that needs to be changed is to push for our Congress and to push for different countries around the world to start realizing this problem. Because as we have seen in history, this problem is not going to get better on its own, and it's not going to get better if we turn a blind eye and say, oh, they can figure it out later, because we have seen that they are not figuring it out and they are struggling to do so. And as the wealth of a nation we are here in America, it's our obligation to help. It's our obligation to help do something. Thank you.